Today, I'm eager to introduce you our first keynote speaker. Her name is Carol Robinson. She is the Chief Nursing Officer and Chief Patient Care Services Officer at the University of California, Davis Health System located in Sacramento. Under her leadership, UC Davis Medical Center has distinguished itself as one of the best work environments for nurses in the United States and obtained successful magnet hospital designations. She has been an invited speaker in 11 different states and internationally at meetings. I can confidently say her accomplishments and experiences in the nursing field firmly support our vision of training, development, and implementation of nursing and leadership. Without further ado, let's give a warm welcome to Ms. Carol Robinson.
Good morning. It's so impressive that you're attending this. This is an amazing conference. So I've been told, this is my job, to offer advice to you on your future in healthcare based on my experience for 40 years as an RN. And I can't tell you, but I've had so many wonderful, exciting, challenging, different experiences, things that I never thought that I would experience when I chose to be a nurse. I thought I was going to live my life at the bedside, but there are many, many opportunities for you. So this is my job today to go through that for you. But I have to look at this. It's a tough assignment because I'm supposed to talk about the future, and does anyone really know what the future is? We look at the future usually from looking at the past and looking at trends and patterns, and we look at the present. I decided that I needed to do a little bit of research and figure out how other people look at the future, and I'm going to quote John, see if I get this right, John F. Kennedy. And he said that "For time and the world do not stand still, change is the law of life, and those who look only to the past or the present are certain to miss the future." So I'm not going to dwell on the past, but I'm going to look at all of those things in terms of talking about where healthcare is going, what the opportunities are for you, what my experiences have been. So give you a little bit of perspective. Let's see. Okay, so I'm sure that most people don't remember the Jetsons or have heard of it, although I hear it's making a comeback. But Rosie the Maid was, and I followed the show because I'm of that generation. I watched the 1962 shows, and Rosie the robot was cleaned the house for the Jetsons. And who would ever imagine that we would have robots today? This is in 1962, so that's what, 40-some years, 50 years ago. It's important because when you look at Rosie the robot, we now have iRobot, which is a robot that is used in hospitals. UC Davis has used this robot. I'm not sure that we thought it was an amazing success, but it's been used, and it's in all of the major journals now. Physicians are using it so that they can interact with patients in the hospital if they're at their office or if they're at a distance, and they can connect with the patient, and they can actually examine the patient using this robot. What we've found is that robots actually are very useful because we've used them as delivering pharmaceuticals to nurses on units. Now, the robots were very useful, and everybody thought this is going to be great. It'll save us time and resources from pharmacy delivering narcotics to the nurses. However, the robot kind of got in the way and occupied the elevators and everything. So I heard from the nurses that they wanted to kick it down the stairwell and get rid of it. That was kind of irritating. But where healthcare is going is that we're seeing more. And I look at all of you, and you're using technology with your phones, and everybody's thumbing when I walked in the room, and you're texting and everything. But what we're seeing now is we're seeing robotic use. I'm not going to talk about robotic surgery, but we're seeing robotic use in our laboratories so that specimens that you draw, if you're a nurse, go right through to the lab. They may be transported by robot, or they may be transported by pneumatic tube system, but the lab then, instead of people using a pipette and pulling specimens out, it's all automated, and it's an amazing thing. So changes in healthcare with the technology are exponentially faster and faster as we go along. One of the things that we're seeing now too is telehealth and telemedicine, and we're not alone in this state. I mean, UC Davis is one of the largest telehealth, telemedicine programs to reach out to people in rural areas. We can use it with nurses doing consults with hospitals in rural areas, but we can also, we know that other states have used it really dramatically in some of the rural states like Kentucky. And it allows patients to interact. We have the EMR, now our electronic medical record, which allows patients to have their chart. How many of you have my chart? Have you with your health provider? Kaiser or with Sutter Mercy in UC Davis. So we've got technology has changed the way that we interact with patients. It's made it better. So in terms of what your role in healthcare for the future is going to be, it's got to blend in with how we use technology. And what I would also say is that we have the VA hospital in Minnesota years ago, probably 20 years ago, was using robots to deliver supplies to the nurses on the units. Now, the interesting thing was these weren't robots that could move wirelessly, and they were on tracks. And the VA is a huge facility, and very huge. And we followed those tracks and watched the robots deliver supplies to the units. The interesting thing was in the basement, the robot, I got cornered, and the robot just kept circling around me, and I was having a hard time. I was in high heels and visiting this hospital as to decide on design of another hospital, and this robot's circling around, and we're going, oh my gosh. But it worked in that facility. And so one of the things that I wasn't prepared as a nurse to do was to design a facility, but I was fortunate enough, this is one of those experiences, where I got to work with architects and travel all over the United States looking at buildings and designs to say, this is how patient care should be delivered in this institution, and this would be how we would design it for nurses so that they could best practice their profession. So that was one of the areas that I didn't know I would learn about as a nurse, but it was exciting. There are actually healthcare courses that teach you about health facility planning. And so that's just, for those of you who are doubting whether you want to be a nurse or not, what's really exciting is you could, if you've got that bent for architecture, you could help design healthcare facilities. And everybody, it's pretty exciting to involve staff nurses in that as well. We have at UC Davis involved staff nurses in designing our facility, where they came through, they measured the heights of countertops, and they looked at the design of a room so that they could move a patient off of a gurney or a stretcher onto a bed, and was there enough room, or did they have to move everything out of the way to get into the room? So actually, the bedside nurses have a lot of involvement in things that you'd never imagine when you're in training to become a nurse. You get to design facilities. The next one is, this is the computer one, and I know none of you have seen these, but I actually have seen one of these. It was one of the first computers in the United States, and it wasn't that long ago. And Dave Barry is a humorist who took this picture, but we joke around about it. But I remember when my dad first purchased the Texas Instrument calculator. He was a mechanical engineer, used the slide rule. Does anyone know how to use a slide rule in the room? Texas Instrument calculator was a big event. The family went to the store to buy one of those, and it was about this big. And it was the first kind of automated calculator that a computer could do. Now what we have is we have the Galaxy Samsung Gear Watch, which is just coming out. Have any of you seen that? It's okay. And it's going to change how we do things. Obviously, it's nice for the women because I can't carry my cell phone around on my person, but I'm looking forward to having a watch where I can call and I can do my calculations, or I can Google by having just a watch that's that small. Of course, I'll need glasses and I won't be able to see it. But the idea is all of these things, these are innovations that are helping change the world and how we deliver healthcare. So there's all kinds of implications for you if you choose to be a nurse. It's not the way it used to be. So why is it so exciting to be a nurse? Change, we've just been talking about some changes, but change is huge. And what we're seeing in healthcare, and I'm looking around the room right now, and I see a lot of men. And when I started nursing 40 years ago, there was no men in either of the hospitals that I worked at, the University of Virginia and in a suburban hospital in Bethesda. And now in our organization, 13% of the nurses are men, and that's climbing. I can walk into a unit sometimes, and most of the unit is staffed with men. Why is that important? Well, first of all, it's important because, as our former chancellor at the University of California, Davis, said, Dr. Larry Vanderhoff, he said, women in the workplace bring a different perspective. They bring different sensitivities, and it's valuable to the workplace. Having men come into a profession that's been predominantly women, having men come in gives us a different perspective. And it's really, really refreshing, and it's really exciting. But there's another part that you should think about. When I've been through 3 nursing shortages because of people leaving the profession, either with burnout, and this was in the dark ages, but now as the boomers start to retire, we can anticipate that we'll need more nurses. And we're now accessing the other half of the population, which is men. And that is going to help us get through this shortage of healthcare workers, and specifically nurses, by having more men enter the field. And I'll mention something else, which is that having men in the profession, it elevates the salaries of the nursing profession. Whether it has such an impact for the future, I don't know, because there's been more equality in women's salaries and men's salaries, but having men in the profession has helped raise the salaries. The other thing about change is when you become a nurse is that it's never the same. So I remember nursing when we would find patients who had passed away in a bed and we didn't resuscitate them. That's how long ago I started practice. So we weren't resuscitating patients. If you can imagine, you go in a hospital today, you expect to be resuscitated unless you have an advance directive and don't wish to be. So you can imagine the change. We also have change in terms of our in drugs. And I can remember starting the first drug, dopamine, and saving a patient with cardiogenic shock, which was unheard of. And the patient, we bought him a year's worth of life, quality life, using that drug. Now I think it's still used, but there's many, many more drugs. So the idea is in the profession that you are always going to learn something, and there's always going to be new innovations, and they're coming faster and faster, like the EMR. And it makes your profession so much more exciting and challenging. I'll talk about something else that has happened with the electronic medical record, which is so exciting. And you don't have this experience, but those of us who worked, again, with the paper charting, now we have a computer. The younger people are able to master that really extraordinarily well. And we see that some of the older people, physicians included, have difficulty mastering that. What's really exciting is that we've been able to use new knowledge about patients who are septic. And when they've got a massive infection. And when they're septic, the mortality rate is really extraordinarily high in the United States. But we have developed, nurses have developed a system where we can identify based on vital signs and temperature and a whole variety of things that are captured on the EMR, we can actually identify that the patient is at risk for sepsis. And it comes out as an alert for the staff. And then the staff are able to actually intervene the minute they get that alert on the EMR, rapid fluid resuscitation, antibiotic administration, lactate levels drawn, and we've estimate that just in the last year we've saved 60 lives that we wouldn't have before. Now, how exciting is that to be in a profession where you can actually save lives and you can see that you're using technology and you're using nursing knowledge and intellect to make a difference? So I could go on and on about some of the changes that have occurred in my life with nursing, but That's one of them. And that's a great example also about evidence-based practice. You'll hear a lot of people talk research. You may not be interested in research, but we have nurses doing research every day in our facility. And I'll give you a really easy example of a staff nurse in the emergency department who decided that with a trauma patient coming in, there's a protocol for caring for a trauma patient, and when they come in, you have to draw serial hematocrits to determine if they've got any active bleeding. And the requirement was always that you'd have to find a vein to draw the serial hematocrit every hour, or every half hour, or every 2 hours. Now, if a patient's in shock, how hard is it going to be to find a vein, correct? So what this nurse said was, why can't we draw the blood from a heparin lock, a needle that's put in and it's maintained with heparin to keep it patent? Why can't we draw blood from that? Well, the physician said, no, because the blood will be hemolyzed and you'll get a false reading on the hematocrit. So what did this nurse do? Scientific question. Went through human subjects, got approval as a study, and drew hematocrits out of the heparin lock and drew hematocrits from the vein. And what do you think he found? There was no difference. How did that change the world of trauma care? He published in the Journal of Emergency Medicine, and it changed the practice at UC Davis for sure. I can't speak to all of the other facilities, but this was probably 10 years ago, and it changed it made the emergency department nurse's life a lot easier. It made the patient's life a lot better, and it gave us really good information. So there's a lot of excitement in nursing just to do the basic research at the bedside that helps change patient care. The other part is that we have continuous learning, and it's a requirement of the profession. And it's a requirement in a lot of other professions, but this one, the knowledge is changing so much that you have to really stay on it. Nurses are highly specialized now, and it requires a great intellect, a great ability to learn. It requires the discipline to learn. So continuous learning is an amazing part of this profession, and you don't get bored. Teaching. So if you like to be a teacher, now we've talked about you could be an architect and still be a nurse and help design healthcare facilities. You can also be a teacher. You're going to teach anyhow, no matter what you think. You will be teaching patients. You will be teaching other colleagues like nurses. You have the opportunity with advanced education to be a professor. You can be an academic professor, or you can be a clinical instructor. You can teach in the community. I started off teaching on basic suctioning techniques, and just the simple fact of having to teach a course requires a lot of research, a lot of communication with others in a specialty to learn how to do that. So just teaching a simple course requires a lot of time. But you can also teach, and I started teaching CPR. I became certified instructor, and then this was we've become much more advanced, but became a certified instructor and taught nurses. But then I started teaching in the church, and I started teaching in the community. So you can be a teacher and use that skill for life, if that's what you choose, and still be a nurse. Management. Not everybody wants to do management, but if that's your bent, there's many, many management opportunities. And in my field, I currently have, I think, 2,250 employees and a budget of $330 million and a revenue budget of over $2 or $3 billion. So I happen to like finance and numbers. So if that's your bent, there's plenty of opportunity in lots of different fields that you can use as a nurse. You can do utilization review, case management, or billing and coding. It takes you out of the bedside, but you need that bedside experience because it helps you with that career, so you've got an option there. of course, managing people, managing employees, and there's any numbers of levels of management available to a nurse. The best job I ever had was a night supervisor, because you learned to run the entire hospital, and you learned where everything was. I learned how to operate a machine that would help me pick up flooded water when there's a water break, and I learned how to operate the machine, or how to operate the dietary department and where they kept the food, and how to, it was an amazing experience, lots of fun, and you connected with everyone. Public speaking, that's not something that they ever train you to do in nursing school, but you definitely have to be a public speaker as a nurse, just when dealing with large numbers of family members, but there's all kinds of opportunities for you to do public speaking with the news media, with the news media, and you can also do it with media training. You can do press conferences. You can do conferences with on TV. I've done. I think it was talk show presentations that were both local and national. And then there's also the public policy opportunities where I've met with the city council, the mayors, the county board of supervisors, state legislators, national legislators, and never expected that I would do that. But I have many staff who actually do internships and fellowships with legislators, so there's plenty of opportunities for you that you would never expect. So I'm going to really move a little faster. I did have this quote from Malcolm X, which is just about education is your passport to the future. And like I said, continuous learning is extraordinarily useful in this profession. So where is the future going to take us? So there are changes to the care venues as we move with Affordable Care Act. We'll hopefully see more patients moving into the primary care setting, but what that means for you is that there's more room for nurse practitioners and advanced practice nurses to see those patients because there aren't enough physicians to do so. We also have lots of end-of-life opportunities, and that's where care, I think, will shift into the outpatient setting, but they're not clearly defined yet. We have lots of confusion in the public about hospice and what palliative care is, and they're different. There's definitely lots of opportunities for us to improve our efficiency. We have to decrease our costs, which means that we have to figure out what the most effective ways are of delivering care. Team care is probably the most important piece that everyone's talking about now, and that requires excellent communication skills to work with the team and to identify quality initiatives. Because, again, the government is requiring that we deliver quality care at lower cost, and they're not going to pay us if we don't. So great opportunities in terms of quality improvement, using lean techniques to make changes. And I think that they're starting to teach about Lean Six Sigma techniques in programs and in classes. And then there's also the issue of workforce diversity, and we see that all the time, that we have to have a diverse workforce to deal with the patient population. So I hope that you see that there's plenty of opportunities. I'm covering a profession of a lifetime in a few short minutes, but I'll leave you with Shakespeare's quote, that it's not in the stars to hold our destiny, but in ourselves. There's plenty of opportunity for you. Continuous education and learning is really critical. Many experiences that you can realize if you try to get in all those different experiences. So thank you.